the Empath Sisters. Join these two healing sisters, Bev and Shelly Greenlaw, walking the path of spirituality and are here to share their experiences and guidance within the realms of energy, intuition, spirit, and beyond.
Hello and welcome back. I'm your host, Shelly. And of course, joining me is my beautiful sister, my co-host, Bev.
Hey, everyone.
And we are super excited to have a special guest today on our episode today. And we cannot wait to introduce her. So we're just going to introduce her. And her name is Brianne Uhryn with WellBelly. And we just are so excited to have you.
Yeah, me too. I'm so excited to have her. Welcome, Brianne.
Excited to be here.
Amazing. Please tell us a little bit about what it is that you do with our listeners.
Oh, sure. So my business here is in Saskatoon, and it's called WellBelly Colonics. So what the main service that I provide there is colon hydrotherapy. So most, again, are still unfamiliar with the holistic style of the service in itself. So it mainly deals with your large colon. So what it kind of is a type of therapy that just uses treated water. So it's very clean, goes into your system, helps remove waste. So that could be impacted stool, stones, mucus, candida, parasites even. It also supports your detox pathways. So your liver can also give a good kind of flush out as well with inflammation or excess bile. And it's just another way to kind of support your system and digestion and also nervous system. So a lot of what my job is now is I teach a lot of people how to have bowel movements, and then just more so how to just in turn get your system to be more efficient. So it's still evolving as kind of new stuff kind of flows through.
Yeah.
So that's kind of like the base of my work.
Yes. And we love your work.
And we love your work.
I know that sounds
it's
weird.
A little quirky, I know, but it really suits me weirdly. If it's good, I think this is it.
Yeah.
Totally.
Yeah, totally. And
I feel like this might be one of those like out there kind of episodes for our listeners. They'll be like, oh, wasn't expecting that. Maybe. Or maybe some of you are like, oh my God, I totally know Brianne, or I've totally heard of this. I was curious about it, you know, or maybe they haven't at all. And maybe this is a service that maybe you need in your life and in your, self-care. It is amazing. I think it's amazing. It's incredible. I would have to say for myself, I have been working with Brianne for, I think for sure over a year.
Yes.
Almost 2.
I think it was very close when I started. So
yeah. Yes. And then, for myself in my journey, I experienced a lot of bloating. I've experienced a lot of discomfort. And naturally, I want to say, like, for myself as someone who's usually in more of a survival state, I know my sister can agree, we're more of like, let's just hang on to everything. And we're just tense, and so that is something also that I've learned on this journey as well, of just more of like that breath work, more of just like breathing, connecting with body, relaxing. That's also a big part of this journey that I've been learning with Brianne as well for myself. But yes, I had experienced hydrocolonic with Brianne for almost 2 years now. I've been kind of keeping it as part of my self-care. I think I usually go typically every 4 to 6 weeks, somewhere in that range. And it has made a huge difference in my life and my body and how everything is functioning and working. And also just like learning old patterns and just seeing how I'm working through those now when they show up. And it's just learning about myself in a completely different way, but yet almost like getting right to I feel like I'm kind of just getting more to like the source of the problem. And it's just been an amazing journey for me. And so I know I highly recommend this to a lot of my clients, especially when I feel that they could also benefit from it based on, things that I'm picking up on or things that I'm hearing in a session. And it was something that I also shared with Shelly after I had experienced it at the very beginning. And Shelly was also experiencing some things. I'm not sure what she's going to share, but but yes, she followed down the path as well. So
Yes, I have. Yeah. Yeah,
I'm
I
just
have.
secretly over here clapping. I'm like,
yeah,
Yeah. Well, that's why I said earlier. I know this may not be like the greatest conversation,
yeah,
but
totally.
like I said earlier, yeah, like very excited to have her on because
Yes,
it's something that we have done, and I would say I'd probably like I know we've taken a break right now because I'm on like a break myself.
right.
However, I have also worked with Brianne at least a year, but
Yeah,
like really back to back. Like I was going every month. I was
yeah,
coming to see her until we took our little hiatus.
yeah.
And I can't wait for another session because I know I'm ready for
She's
it.
due.
I do.
okay, we'll remember. I promise you, it doesn't just go away. So.
No, exactly. And like Bev
Yeah.
said, like for myself, yes, like I was suffering for a long, long time with gastro. I've been diagnosed with IBS and I had a lot of
Right.
flank pain. And every time I went to to see a doctor about it, they were always like, oh, everything's normal and you're fine.
Yeah.
And you're just diagnosed with IBS and you're just going to have to deal with it. And you just watch what you eat and,
Yeah.
all those things. And so I got to the point where I was just frustrated. And,
Of course. That's very frustrating.
Yeah.
When you're experiencing this and you're having all these tests done
Mm-hmm.
and they're just like, you're fine. You're
Yeah.
normal. There's
Yeah.
nothing wrong. You
Yeah.
just have IBS and okay. And I know even for you, Shelly, they at some point they had recommended like a nutritionist, I think, and
Yep.
it was like,
Mm-hmm.
let's cut this out and cut this out and that. And it was just
Mhm.
like literally I
Yep.
felt like your world just was shrinking and shrinking because it's like, well, I don't know like when it comes on. I don't know like what I'm
Yeah.
eating, what's causing
Well,
this, right?
yes, yeah. Yeah, they did recommend a nutritionist, a dietitian, and I still remember my first meeting with them. They were like saying all these things, and I go, I do that, I do that, I do
Yeah.
that, I do that, I did that, I did that, and they're like, oh, and they're like, well, in a way, they were kind of like, why are you seeing me then? And it's like, I was just told that I was supposed to see you
Yeah.
because
Good question. Can you help me?
So so
Yeah.
then they were just literally just saying to me, well, the only thing I can really suggest is to follow this. It's called FODMAP, I think, or food map.
Mhm.
I can't
Yeah,
remember how you
FODMAP.
say it. It's FODMAP. And I was already doing half of that already. And so they
Yeah.
were kind of like, okay. And I've gone to like to the point where I needed just, pain management. And it wasn't like
Yeah.
I'm taking drugs for it. I'm taking like, Patrazole for my acid reflux, 'cause it's
Right.
like, well, let's help with that,
Yeah.
or let's take, Buscopan because that helps the cramping and like the stuff that you're
Right.
getting and let's loosen that up. And so it was getting to the point where I was taking so much medication that I was just like sick of it. And so
Yeah.
when I started seeing Brianne
Mm-hmm.
and doing her hydrocolonics,
Yeah.
I will have to say I'm really proud of myself because like I'm now down to just like, let's say in the past when I
Yeah.
had to take medication, it would be like 3 times a day, right? Now I'm
Wow.
down to 1. So I'm at least controlling that. But it's also, I know it, I'm going to get like this, like,
Hey, we're not in a session. This doesn't count.
I know, but it's not even just that, but it's just like I've been told so many times that it is stress related, and I know it is.
Yeah.
And I know I actually do know most of my triggers. And
Yeah.
but I will say this. When I started seeing Brianne and I started kind of like finally slowing down and all the things, I honestly have had like less I call them attacks, but
Right.
they're less, right? And so it's just been great. And like I'm a weirdo, probably like Brianne, where I'm just like so cool. It's so cool to watch. I know it sounds awful, but I love like what is going on with that waist in there?
Yeah.
I don't know.
I'm not like that. I just look at Brianne the whole time.
I get a mix. I'm like, do you want to see it? I also take videos for people because then it's like, it helps me even just like sometimes people are visual. So when I can tell you what's coming out and explain it better, it just provides you more education for your own health. So then you know what you're seeing at home. I'm not looking at your poop at home.
Right?
For the most part, people do. Some people don't at all. But your poop's like a great indicator of your health. So I feel like I just educate through that as well. So again, the more information you kind of know, I always just think knowledge is power.
Yeah.
Oh gosh, yeah.
Why don't you explain to our listeners, what does a typical session look like? So that
if they're brand
because
new,
there's some people are like don't know what this is or how you do it or what you do really. So if you could give us a
and I'm sure they can only imagine some horrific things in their mind as well. So maybe we can put some of those things to bed. That would be really great.
I mean, I've also was a newbie at one point too, so I 100% had no idea sometimes what I was even walking into in my first appointment or session. So I feel like it's not as scary. I always just kind of like had of being like, sometimes we go down that rabbit hole and think worst case scenarios, especially because it's a region that is sensitive, less talked about, something that is just always on the hush hush. And people, it's like, it can be like quite like invasive for some. So I really just try to make sure that like you're comfortable. That's usually the first thing I always ask how you feel when you kind of come in. So that is just kind of, so then I kind of know what you're kind of at. So, and then I just explain everything. So in an initial appointment, usually the first like 15 to 30 minutes, sometimes we're just chatting. So if it's your first time ever having a colonic, I explain the machine, the kits. So my little spiel is explaining that usually that it's FDA and Canada Health approved. So it's regulated just from a safety side of things. And then explain just how the flow of the water goes through the machine. So it kind of comes in. I have my own like special setup that I have prior to even going into the machine just to fit city regulation and guidelines. So there's like backflow valves and like another kind of sanitation piece with it. And then the water flows through the machine. It gets triple treated. So that's UV filter, carbon, sediment filter. And then on the side of the machine, there's a port. So that's where the water kind of flows out. And then it's attached to the speculum kit. Because this is where people are like, how does this actually all work? This seems like what's happening.
And I like how you said speculum, because now people are going,
like, hold on here. So really, I always explain to people, like, you guys actually have bowel movements that are larger than the speculum that glides in. So it's like the size of like your finger, double finger, just depending on the size. Lubrication is applied at the tip and at the rectum, so it's just for ease. And it's not force. It's just like glides in with your muscle. So the speculum has a stop disc part of it as well. So it only goes into your rectum and that's where it stays. And also how it provides a seal. And then on the speculum, it has a port attached. And one of the port is for the water that's attached to the machine. The other port is at the end of the speculum, and that's where the waste flows out, and that's attached to the bottom part of the machine where my nice viewing tube is on the machine.
Right.
So that's kind of where it's kind of like you're all one kind of system. I call it a really high-tech toilet where it's
literally
flowing in and then flows out, and then away it goes into the plumbing system like a toilet would.
Right.
So it's all kind of one connection piece. No kind of smell, because that's usually a common thing. Some people do bypass in their first couple sessions, and it's just minimal. That usually has a lot to do with muscle aspects. So I always just highlight it to not be embarrassed. It's you retraining and relearning your system as we get it more efficient. And I always just kind of like remind people I am a nurse. So body fluids in the body, it's nothing new to me. I find this actually very clean work. Clean as possible. And then after that, we kind of explain that, we just go into like your health. So I kind of just take the time. I don't like to rush it. That's why I have like sometimes 30 minutes before we even get into the session. So you guys really, like as a client, get time to really explain. I can ask my questions. So I just really understand the baseline of your system.
Yeah.
So I go over what your hydration is, like diet-wise, your fiber intake. We talk about stress, because again, a lot of that stuff is me explaining, again, how do you, like, what goes on with bowel movements. So your nervous, that's where nervous system plays a role, and we talk about that as well. And then I talk about your activity level, just for baseline, to see what kind of movement you get in your day today, and like, I guess in a week or a month. And then again, how do you have a bowel movement? Those are questions most people don't ever get asked. So do you sit? Do you have to lean? How do you actually have a poop?
Yeah. Right. Yeah.
And so it just, all of that in a whole, it's me looking at your whole system and seeing how it actually all functions. So that when you're on the table and we're working through things, I kind of already have an idea of how your system's going to respond, and me trying to help actually move through a release a little better. Yeah. Because the goal for me, I always explain it, is for your system to hit rest and digest. And so that's where that nervous system moves over, and we allow the system kind of flow, and that letting go side of things. And then in turn, when you're on the table, I see what your muscles do when you kind of release. So again, mimics exactly having a bowel movement. And then on term, I get to see what kind of comes out. So that tells me what's internally going on and what's actually overwhelming your system. Yeah. At the start, all your clocks can be so different. I try to help people not to get so fixated on what exactly it is. I'm like, we're just trying to see what's kind of coming out and clearing things out. Right. So once we kind of work through at least 3 sessions, that kind of gives me a good picture. We kind of really clean out your large intestine, and you kind of get little things to work at in between our sessions. And then we kind of just start from there. In general, it takes clients about 3 to 6 months for you to kind of like symptoms start to improve. You start to have when I start to ask people about their bowel movements, color, consistency, size, they're actually like, okay, I actually don't think I've ever pooped well then. Don't worry, like I was the same. And so it is just understanding that this does take time, and because you've been doing something one way, if that could be your nervous system, muscles, obviously like diet, habits as well, that just could be re-triggering your system every single day and have no idea. So for myself, it is finding more root cause and kind of working through that way. So that's kind of in general how a session kind of flows. You're on the table for 45 minutes after we kind of debrief and then work on that plan of essentially what I've all kind of mentioned. And then we kind of just work as session by session. We just kind of keep doing small tweaks. This is something that just is new though. I did just get this to become a registered nursing practice for myself. So with that, I know it took like 2 years, but we're trying to mesh both worlds. So with me being a registered nurse and working within the Western medical system, but then with my own health and seeing the benefits of the holistic practices and wellness kind of practitioners, there's benefits to both, and you need both. So really blending 2 kind of worlds, and because that is one day hope because that is where I think true healing actually does happen. So with that, my practice does, you get a full report. Usually it's kept within like my own system. So when referrals come through with other practitioners, I'm big on collaborative care. So you personally, if you want it, I just send it to your email. You can send it to your practitioner so that everyone's aware of what kind of goes on. So that, and then again, that's kind of where I've noticed a big gap between the Western medicine and holistic, is that just like that no communication kind of concept. So really kind of bridge some gaps with this as well, because it is new. So I do get it.
That's amazing. Sure. I love that. Congratulations on that accomplishment as well.
I know that was just pretty recent. So I know you guys have known that I've been like humming and hawing and trying to figure this out for a while. Like, do that. But it's just, I kept getting pulled towards it. And then we talk about alignment, and it's like, you just kind of have to, like, there's little signs that keep kind of popping up. And
for sure. Awesome.
Absolutely.
So I guess
amazing.
I want to just sort of ask you a couple of questions, just so like maybe some of our listeners are thinking and they can't, ask the question on here. But when it comes to the type of method that you do for hydrocolonics, like with the water system, can you explain to others, because there are other ways of doing hydroponics. Could you explain like the difference between, like, I know you explained what you do, however, there are others that, like, I know I have a friend who does this work, but you do it. You know what I mean? Like, can you explain the difference between
Oh boy.
two?
I don't know if I could do that.
Yeah, I know.
Because my first colonic experience was in Australia when I was travel nursing, and it's a different system than what I did, what I do now. So my method is called a closed system, where the other method is called an open system, or also it's called woodland. So that like name really came from actually like overseas in, I think it was like the UK, because I guess Princess Diana used to do them. Like, so it kind of like, so with the open system, you were kind of like on a bed, kind of like laid out with your knees kind of propped up, and then there's kind of like near the, like where your bottom end would be, there is a kind of a hole, and that is kind of where your waist would kind of go through. So you actually don't have a practitioner with you bedside. You kind of do the filling and releasing yourself. So you insert the speculum, or it's looked what I would call as a yonker, what we use in the hospital for oral surgery, and that is what's inserted into your rectum, and it's connected to the wall machine. And that is where you control the filling. So just through your breathing and like, so that breath work, you kind of let things fill. And then when you're ready to let it go, you breathe, and it kind of, the water just is continuous, but it kind of flows out. So usually people that really struggle kind of, they just want to come in, do their kind of regular maintenance. That's usually like more so for, I feel like for more experienced kind of colonic users. They really seem to do it because they know their system. They're just there to kind of come in, have their kind of session, and kind of go out.
Okay.
Where people with the closed system, like I said, you always have a practitioner there, and they're the ones controlling the filling and the emptying. So that's kind of like the main kind of aspect between the two.
Okay. Perfect. Yeah. Like I said, I know I've talked to you about this because I was like, I do not want an open one. And like I said, I do know someone who does that. And I definitely knew it was not for me. And I just found that it was a little bit harder to find people that do the closed system than the open system. Yeah. And so thank you very much for, clarifying that for sure.
I usually find the open systems are more common practice in like Europe and Australia. That's where I've like, because even that's actually what sparked it. Was my first colonic was actually in a nurse-run clinic. So, and she just had rooms, and they're just like all set up. Like she's there to like set you up and get you kind of going, and then once you're kind of used to it, you're just kind of like doing your thing. And I was like, this is so okay. I don't know what I'm signing up for. And then I was like, but it was just like more so like how I felt after my first one. I was like, that was the wildest thing I've ever done, but I feel so good. So it feels, you just have like conflicted feelings. But then once you understand it and how it moves, you're like, okay, there's like, I'm not just going to be by myself. I don't have to do it. So there's other options with it. So
like I would have to say for myself, like I like I said, I know someone who does the open system, and I knew I didn't feel comfortable wanting to do that at all. I've heard of, hydroponics, all the things, but I was just like, I'm not doing it myself. No way. So I will have to say this, that when I started seeing you, Brianne, it was just so much more comfortable for me. And absolutely, I know some people can't and don't want to do it. And maybe they'll want to do it the open way, and that's great. But for myself, I felt way more like I just felt more comfortable having you there. Plus knowing that you are a registered nurse, knowing that if there was anything to happen, it would be right there. Right. So I wouldn't have to worry about it. And I do appreciate that.
I also I was like, what's coming out? What's happening? Like, that was that was just more so for me, because I think just with my nursing education and background, I had that curiosity, but then I also didn't have anyone to kind of ask to start. And I was just like, I have way too many questions. My brain's going on and on. But I have no one to ask. And then after, I feel like I couldn't explain it well. So I feel like she was just trying to be like, oh yeah, like
Yeah.
more so this is that and that like aspect. But I was like, okay.
Yeah, for sure. For sure. Yeah. No, that's just something that's just for me anyway. And I know I'm sure Bev agrees the same way. Like I couldn't do the open.
No.
For sure.
Yeah.
No. I'll post a photo because I was actually to do it. I call it like the colonic world tool just because of how many practitioners I've kind of ventured around and kind of just gotten just try different colonics from different methods like that, and then try different practitioners. And I'll show photos because it is just like just seems like it's so nice. Got a blanket, you're yonkered. Like here's the remote control. There's like Netflix. Enjoy. Okay. But I was like, okay, this is way more chill than I would have anticipated.
Yeah. Yeah, for sure. Yeah.
I would just be watching Netflix. I wouldn't do anything.
I was like, okay.
No, I would just be like, I need your help. You have to help me here.
Exactly. I'd be like, I'm just going to sit here watching Netflix then. I just have no idea. Oh my gosh.
There's benefits to both. That's why it's kind of like whatever kind of suits you, you can kind of find. I just find at the start, if you have a trouble releasing, that is kind of a nicer option sometimes for people because it's more nervous. So I find clients that have troubles in public areas, traveling, or where they're out of their home, it kind of just you do better by yourself. That's why clients, even at the start working with me, they will release really good on the toilet. And it takes a couple sessions for their systems to feel calm and relaxed to start to release with me. And they get frustrated with it. But I'm like, no, this is just your system. Like that's where I'm always like, you can't rush it. Trust the process. Mm-hmm. I'm like, it will eventually kind of happen. And then when it finally does, they're like, oh, I get it. And I'm like, it just takes its time.
Yeah, for sure.
For sure. So are there any restrictions? Is there anything that is it for everyone, or is there certain people that can't do this, or could you explain that?
Yeah. So like everything, there are certain things that don't apply. So I'm pretty strict with what those guidelines are. I'm big on safety.
Of course.
So with that, it is anyone recently that had any kind of rectal or abdominal surgery within 4 to 6 weeks, just because you actually have to allow for proper healing to take place. Anyone with electrolyte imbalances, so that also refers to a lot of kidney issues as well, mainly because of the hydration side of things.
Mm-hmm.
Cardiac aspect. So if you have uncontrolled hypertension, any new heart rhythm changes as well, and you're starting to be on new medications, that can also, just because of the detoxing side of things that happens with waste removal, that can sometimes you already have a bit going on, that can also affect some things as well. Unfortunately, if you do have bowel cancer and polyps, just because that would be considered an obstruction. My machine actually does tell me when there's something that the water won't move past. So that is actually a cool safety thing.
Nice.
That is part of the machine. So sometimes I actually do have to stop mid-session and be you have to go see a physician because there's something going on that I obviously can't physically see. As for rectal stuff, I get asked about hemorrhoids and fissures quite a bit. So if you have a massive flare-up or extreme hemorrhoids, external or internal, you have to wait for that flare-up to kind of settle. With hemorrhoids, usually that comes with bowel irregularities. So I just have to make sure that they're not in a flared-up state. Once you kind of get them, they are kind of with you. So I really help clients kind of work through that as well, just through a lot of education and prevention side of things. And it also kind of helps your system help kind of move through waste, because your system does get scared when you have flare-ups like that, and you actually start to hold rather than actually let things go. It's the same with the fissure. So that is actually a tear in your rectum, which happens quite a bit with people who have to push or strain or have really constipated stool. That actually has to be fully closed. So before anytime I insert this speculum, I am assessing your rectum, because I always check to make sure nothing new has happened, because or else I won't insert the speculum, because that would just actually cause more damage and harm.
Okay.
Other kind of usually some cancers. Like I said, it's usually strictly to the bowel for the most part.
Yeah.
I'm trying to think if there's anything else. AAA, like if you have an aneurysm, that especially the abdominal, that's a hard no as well.
Okay.
I'm trying to think. These are just what I'm like really remembering. I have them all listed on my website. So and then like even when you're doing your intake form, all those contraindications or what they're called are also listed. So you'll be able to kind of see. So if unfortunately if you do deal with it, I usually just say reach out and see, because sometimes it is situational, and that maybe you just not maybe a candidate for right now, but you could be in the future. Just so you know, it is still an option for you. But that's all kind of listed between their website, and then when you're kind of booking your appointment, that's all kind of listed.
Okay, awesome.
Any issues with anyone that's diabetic, just like with kidneys as well or anything?
No, I've actually had really good success with some of my diabetic clients as well.
Awesome,
so
good.
A lot of it has to do with absorption and just with help regulating blood sugar control, especially when we talk about diet and stuff and fiber intake. Like I said, most people actually miss it's actually like soluble fiber, so that actually helps blood sugar control. So it's just sometimes just other things that kind of like don't, again, people like from a healthcare system, no one ever asked me about my poop. So I really like dive into it because it does have a big effect.
For sure.
So
awesome.
Could you explain to our listeners too, like, would this be like a colonoscopy, or is this different from a colonoscopy?
Or like an enema?
Yeah.
Like a coffee enema.
I get the infamous questions. Some people have been like, oh yeah, you do the colonoscopies. So I was like, no, those are two very different things.
Right.
So I'll start with just like an enema. So essentially a colonic is a large colon enema. When you do a fleet enema or an at-home enema, even like the tap water enemas that can be done in hospital as well, those actually just treat your sigmoid colon. So that is just like your left lower quadrant part of your colon. And that's all it kind of like will help kind of like move waste out of. When it comes to colonoscopy, that's actually a procedure, and it's a diagnostic procedure, and it's done by a physician or a surgeon, where you are given a prep and you're also given medications during the procedure itself. And that's usually to kind of like relax you and get a little bit of sedative, because it's actually a camera. So that will go up into your rectum, a larger colon, and a bit into your small bowel sometimes as well. So very different. So that's where they're looking at more structural things. So they're looking at the colon lining, seeing if there's any polyps, any different kind of just like tissue that looks a little off. Then they'll like be able to take biopsies. Or same with hemorrhoids, they can do hemorrhoid BAMI through it as well. They could also like, it's called, so there's like the sigmoid oscopies. So it's just, again, you're only checking the sigmoid. The colonoscopy does the whole thing. Now with a colonic, I call it like an internal facial. That's kind of, I try to make it sound like a little more, I'm like, it's really hard to make it sound really cute and like not so.
Yeah, not so like,
or an internal oil change. Like, where it's just using water. The prep for it, I send out, because I do, like I said, like I want most of my clients get the most they can out of it. So you get the prep information prior to your appointment and the post-treatment information as well. So how to care for yourself after. The prep for it is mainly like making sure you're hydrated, avoiding heavy drinking and caffeine intake before. And if you really just want to help with the detox side of things, avoiding stuff that's going to be more like inflammation and mucus producing. So spicy foods, sugar, processed meats, that'll just, again, you're just kind of prepping your system to kind of help get rid of some of that waste. And then I kind of feel like I've already explained exactly kind of how the treatment goes. So again, you're not given any kind of medication or like some sedative prior to. I really get you to hold, like I explained, the breathing that I really get you to focus on to allow your system to relax and allow that nervous system to really switch over, to allow that rest and digest to happen and for your system to release and let things go. So it really is giving the tools for your system to be the one to do the work. And I'm just there to kind of support it through. And then I do abdominal massage throughout. So I'm helping to release that tension and where that buildup kind of is. Because where you hold tension in your belly, you usually got some things stuck there. So whether that means some built up or some gas. So I really just kind of help work those kind of like things out throughout. Water's goes in pretty slow and gentle. And we really just like me and the client, like work together as a team to kind of make sure that you kind of move things through and like release that way. So they're all very different. They all have different purposes. So it's kind of like they all kind of, So that's kind of like my best explanation for like all of them.
Perfect.
Yeah. So how can I ask a question of like, how would somebody know if they needed it? You know, if they are like, oh, I've never heard of this, what would I go for? You know, if some people don't even know about parasites, some people don't even know if they have parasites or, you know, if they're experiencing all these things and it's like, you know, how could this be such like a benefit to them or maybe help them on their journey? Would there be anything that you could share with our listeners?
Oh, for sure. So in like for a generic kind of like, if you're looking at the typical kind of client, it's really kind of any bowel irregularities. So that could be diarrhea, constipation. It could be the fluctuation. So you're getting both. Also indigestion, bloating. And then on top of that, like just from a whole, like you're just feeling very run down. Your energy is kind of low. You're noticing skin changes. So that usually is a sign that like liver and gut are not efficiently letting things out. Your skin's an organ. So usually that's telling me something's trying to release out from somewhere because it's not kind of exiting. And then for a bowel habit side of things, if you're going more than 3 times a day or less than like 1 to 2 times every day, or like once or twice a day. I may have saying this wrong. If you're not going every 2 days, there's something going on. Sometimes for people, I was like, how am I wording this? So you should be going at least once a day. Some people's systems, if you're stressed and going through things and you don't go for a day or 2, but then you have a really good release after, that's okay. That's still telling me your system's still releasing. It's efficient. That's fine. It's just not to stress out about. There's usually like situational things that kind of happen, but those are kind of the big things. If you're going less than that or more frequently, something's going on there. And then, well, this was for myself. If you deal with any kind of like hormonal or uterus conditions, so endometriosis, PCOS, that is kind of like another thing that's kind of what got help my own self. Was really understanding the hormone side of things and how when I looked at the system as a whole, rather than just piece by piece, it kind of made sense of how they all kind of function together. So your digestion, your detox pathways, which is your liver, just from a female side of aspects, all your hormones are metabolized in your liver, and that's how they get excreted. So either through urine or your feces. So if you're having some sort of change in things, and you're noticing different things between your bowels, especially leading up to your period, when you're hitting as a female, that luteal phase was my biggest issue from a bowel side of things. And it went on for years and years and years that I just didn't understand why. So we figured it out because it was hormonal stuff and then muscle tension and the combination of it all. So for my own personal self, that's why for like 2 years straight, I would have a colonic every month, leading up to my period. Because what happens from a hormone side of things, in that luteal phase, your estrogen decreases, your progesterone increases. With that just shift, it actually slows your gut motility down. So that is why you get more bloating and usually by constipation or some sort of, or you can have loose stool or constipation. It depends on person to person. And then as a female, when you start to menstruate, that's why we usually call it the period poops, because your hormones go back to like how that level should be and things start to flow out. So that has a lot to do with it. So this helped a lot of my endometriosis symptoms, from pain, bloating, back pain. That was something that I found quite beneficial. So that's kind of like, for the most part, the like ideal clientele that would really kind of benefit.
Yeah.
Other ones that I have seen though
Yeah.
are cancer patients. So a lot of the medications that they get put on, and same with the chemo radiation, really does take a toll on your detox pathways and your bowels. So it really just, this is where the coffee enema has been super beneficial for a lot of them as well, because it really helps let some of that stuff out of their system rather than recirculate.
Nice.
And then any kind of people that really struggle with inflammation, that is another thing as well, because that just, again, gives another support to kind of help your system kind of release and let it go. That you just don't know. So if you kind of deal with a lot of like puffiness, swelling, that is, or like you just kind of notice that like the fluid exchange kind of fluctuates, that usually is another kind of sign that your detox like pathways aren't efficient. But then that's also where I get to like incorporate other people into your guys' care. So that is like collaborative health. So usually I'm like, okay, if you're dealing with this, there's like lymphatic, or if you have this, there's pelvic physio. If you have this, go to your GP or just physio. Or if you need more energy, nervous system, like go to QC Reiki, spinal energetics, acupuncture. There's just so many other awesome things that I get to actually like help kind of guide people through that. Just again, other modalities they've never heard of. So
no,
absolutely.
That's kind of like, those are my ideal clients, but then I'm also like, these are other people that I can also include.
Absolutely. That's awesome. I love that. Thank you for sharing that with our listeners, because maybe it'll just start to plant some seeds of like, oh, maybe this is something I could try, because maybe I do suffer with those things. I know for myself it was not being consistent. For me it was inflammation. For me it was puffiness. I mean, I was just always sore in my stomach all the time. And it was just, I remember after the first 3 colonics that I did with Brianne, I remember just feeling no pain, no bloating. And I remember saying to my husband, like, wow, this must be what it feels like to be normal. Like to feel no pain. Like it just blew my mind, because the pain and inflammation was my normal. I didn't know anything different. So it was just like, oh my gosh, like it was, then I craved it, because it was just like, there is hope. I can be normal, and it was just, game changer for sure. That was like my biggest moment for me, for sure. And then it's helped me in so many other areas. I know, I remember even seeing Brianne, I think after 3 months, I remember going to the gym. I had been going to the gym regularly, working out, taking all the supplements, protein. And I remember Brianne explaining so much to me, even about absorption of nutrients and protein and all the things. And I'm like, I just didn't feel like nothing was changing, no matter how much I was going to the gym, no matter what I was doing. And after 3 months, I remember starting a warm up at the gym, and I started sweating, and I was like, what is this? I've never sweat before. Like it was blowing my mind. And then I was sweating so much through my whole session. And then it just kept happening every time I went to the gym. And I remember telling Brianne at my next appointment, like, I don't know what happened. All of a sudden I just started sweating. And I remember Brianne telling me, like, that's a great sign now, like things are moving, and also like your nervous system is healing and it's letting things go. And I'm just like, oh my God, that was just like such another amazing thing to hear about. Like, I'm just like on a good path here. There's like so many good changes that were happening that were so positive. So yeah, I mean, there's just so many benefits that I have experienced, from cycle to inflammation, pain, eating gluten, to like you name it. It's just helped me in so many areas. So I'm super grateful for your work, Brianne, for sure.
I totally forgot about that you went through that. I was like, yeah. I was like, oh, yes. I was so stoked for you. I was like, yes, you sweat. You're like, you're
never had. And
that means that you're doing the work too. And I think that's like a really enjoyable part for me in my job. Now it's like, I like see people really come in and they're like willing to make the change, and then they see the benefit of it, and they understand that the progress and how their body heals is slow, but like talk about like just be consistent. Yes, you're gonna have those like little blips, but that's also how you heal. That and then you're gonna start to notice those like long-term changes, and they're gonna stay. It's not just something that will like come and kind of go. Your body will respond to it. So when people come for their like follow-ups and they tell me all those things, like stuff with you, Shelly, and same with you, Bev, I get like internal clapping, and I'm like,
Yay. It's incredible.
It's nice to like see, and it's also like I kind of like explain it like my work is my business plan's kind of backwards. It's like I'm not meant to see you all the time. Eventually, like if I did my job well, I will see you a couple times a year for your like maintenance and like or whatever your maintenance may be. But we're not like starting from ground zero, and your system isn't going all the way back to how things used to be. You can work through those life stressors and work through all those things that maybe would have like flared up your system or re-triggered it. But at the end of the day, you like get a lot of those, you know you can do it. You have those tools in your back pocket.
Yeah.
And then your system like responds well with it. And then you're like you mentioned, Bev, like I didn't know this is how it's supposed to feel.
Yeah.
That's like what you should feel.
Yeah, absolutely.
It makes me feel like yay. I don't know how to say it, but it's great.
Well, and even for a lot of women too, when they have a lot of like endo symptoms, right, and stuff like that, where they're going to tell you this is just normal, your cycles are this is normal, pain, all the things. And you know what, there's so much of what I feel like a disconnect in so many areas. And so it's just also nice to hear that, you know, that's helped you and it's helped me too. And I didn't have endo symptoms, but it's helped me a lot. And even temperature regulation. Like I used to be a freezing cold person all the time. And now I'm just like normal. I don't even, and I honestly, when I started seeing you too, society told me I was like going through perimenopause symptoms. And so I can tell you that for sure now I don't have any of those symptoms that they told me were normal. And so I don't have those, like the hot flashes. I'm not freezing cold. I'm totally normal. Everything's feeling so good. I don't have like that fogginess in the brain or the forgetting and the memory, like all these other things I hear other people suffering with. And it's just made, like I said, there's so many areas that I have noticed for myself of like, wow, that's better. Wow, that's improved. Oh my gosh, that's completely gone. And I just love it. I'm just so grateful that something just led me down this path. I actually heard about hydrocolonics, I think from two people a couple years ago. And I was like, oh, interesting. I didn't even know it was here. I thought, well, maybe I'd go to Kelowna because Kelowna seemed to be more up in the times. And I also thought considered going to the States to get it done because I thought, well, they're up with the times too. They've got more to offer. And then I started hearing more about like coffee enemas and how it can help with like the liver and like more energy and things like that. And so, and then all of a sudden, literally one day, I saw somebody sharing your page. I think you were doing a collab with your doctor friend, I think Dr. McKenzie.
Yes.
Yeah. And I was like, who is this? And that was it. And it just, I thought, you know what? Oh my gosh, I'm going to check it out and I'm going to see what this is all about and if it can maybe help me. And it sure has. So yeah, it's amazing.
Now look at us 2 years ago.
I know. It's awesome. And I also want to mention to our listeners, it's not messy. It's not disgusting. It's not smelly. And it's not painful.
Oh yeah,
so I just want to say that.
Have those thoughts, and the common thing is like if you go on the internet, things are going to tell you differently.
Yeah.
So I was like, just stay off of it for the most part. But like, and like I get asked about perforations and infections a lot. Perforations, I personally have never ever heard of happening. Even like when I've gone overseas, that was a question I even asked every practitioner that I personally did it, and they're like, I don't understand how water would cause that. So or like your speculum is only going into your rectum.
Yeah.
So, and the only way infection would happen would just be based off practitioner if they just weren't using proper hygiene. So again, like any type of practitioner or any type of practice, just like look into who you're going to go see. Yeah, because not everyone has the same background or credentials or in that way. And it is trying to find the right practitioner for you that aligns with your health and who you're kind of wanting to see. Because that always plays a massive role. And it may take you a couple to find the one that clicks, like any kind of thing. So
of course,
it's just who you got to feel like comfortable with and like trust, literally trust your gut. So
Yeah. Yeah, absolutely. That is a big, important factor.
Yeah, and I was going to add about when you said, you're comfortable with the practitioner. My husband sees you and he says he only will see you because he only feels comfortable with you. So
Yep.
So it's also not just for women, there are men too.
Oh yes, men do go.
Yeah.
Yes. Yes.
Yeah, there is that they're like, okay, it wasn't as bad or as weird, or they're like, I don't know how you do it, but you make that the not weirdest, most weird thing you were about to experience.
Yes.
Really make it like it's fine or normal. And I was like, you know what? That is probably the best compliment I've
right?
So
Yeah.
I was like, thank you so much.
Oh
yeah, my husband definitely loves Brianne in a a platonic way, of course, but just like in the whole he always feels great after his sessions. So he won't.
Yeah, you're his gal.
Yeah, you're
not
his
seeing
gal.
anyone else.
He won't see anybody else.
Brianne's my gal.
Brianne's the only one that can do that to him.
Yes.
That's it.
Wait, you can't trust it, but that's okay.
Yeah. So, but yeah, I just wanted to point out there that it's not just for women, that men can go too, and that like my husband does, and he. I wouldn't. I'm not. I'm going to say it. He thoroughly enjoys it because he does feel relief.
It is
when he goes.
Relaxing, and you do feel better after. So I think it's like, because you do notice. For some, it does take a couple of sessions depending on how willing it is to let go. But once you kind of hit your maintenance, and your body and system understands the sensations, you understand the breathing and the muscle side of things, you really feel you sometimes feel like you're going to float on out because you really allow that system to switch over, and you get rid of some built up waste and stuff that's been hanging in your system. So like I said, a really good internal facial.
Speaking of waste, so can you explain to maybe some of our listeners how long that you could maybe even holding on to waste?
It could be years. Like when you talk, how I best describe it is your colon is a bit of an emotional hoarder. Mm-hmm. So when you kind of do go through things with life, and if your way of dealing with stress is actually to tense and holding your belly, you're going to have some things there until you kind of move through it and kind of let things go. So I mean, I've had my when I did my training in Toronto, my practitioner did tell me she said she removed a Barbie shoe from a 45-year-old female.
Oh my gosh.
I would have been interested when she would have been a kid. Yeah. So you really don't know what could really be in there. Your colon's 5 feet. And so it'll still make pathways. Your system is smart. Even though you could be pooping daily, but when we talk about in session, what an actually healthy bowel movement looks like, you're probably not releasing. And then when things kind of get stuck on the walls, that's where the buildup and then things start to kind of fluctuate within your system. So that's why you get the symptoms. I kind of explain it as your cup's full. Mm-hmm. So anything you kind of pour into it, you have no capacity or space. Right. So if you are consuming more mucus producing or inflammation based kind of foods, your system has no capacity for it. That's why you get symptoms. So that could be why you get some bowel changes between constipation, diarrhea, bloating, or indigestion. So a lot of it is just trying to settle things out. But
I have a question. So I think we've talked about this, but I'm not sure. I can't remember. But I was it just hit in my head, and I was thinking. So for example, you say when you have a bowel movement, right? And let's say, I'll do 2 options. So maybe one person really just can't go in public, so they hold it. Yep. So then that feeling of going to the bathroom again goes away. So does that mean that eventually does that come back, or does that stay in the system and could be held there for a long time?
Yes. So that is actually a common thing that I see with a lot of my clients. And where clients actually self-constipate. So that's why it becomes a muscle issue. And then it will bulk. So what ends up happening is you're kind of also retraining your system that when it really does want to have a bowel movement, you're stopping it.
Right.
So then it causes your muscles to tense and tighten rather than to actually like go to the bathroom and let it kind of flow. So over time, you will bulk, and that's where it starts to build in the sigmoid and then that left lower quadrant. So for a lot of people, if you are kind of flat up top and got a bit of a bulge over in that lower belly, and that's where you usually bloat and feel heaviness, you never feel like you're fully empty, that is probably what has kind of happened over time if that's been your kind of like natural routine. So it's hard when people go on holidays and trips. So like, I didn't poop the entire week or 10 days.
Yeah.
Like,
I know people like that.
And I was like, how are you right now? I'm like, not good. I'm here. And I'm like, okay, we're gonna
Yeah.
So it is, but then when I explain it and I give you tools and exercises to kind of help do that when you're on trips and holidays to kind of reverse it. So it's more so about a safety thing for people. And that comes down to nervous system, that they feel really comfortable and safe in their own house. And that's why some people even like, I have to leave work and go to the bathroom during the work day, and I go and poop at home. Or same, like if they go and stay somewhere else for a night or a weekend trip, like I just don't go. Yeah. And so it is retraining that system to like, it is safe. I gave you, there's little trips and tools, learning when you start to understand how it actually all works, when I explain it in session between the nervous system and the muscles, and you get to visually see what's going on, you kind of, it connects dots for people. So then they realize, oh, this isn't like, I'm not weird. I'm not like abnormal. It's just understanding your body and learning the patterns for it. And so I'm like, it's never going to like go away initially off the hop, but you'll be able to work through it. And it's honestly, it's so great because usually if that is kind of their troubles, I will see them after a trip and they'll come back and like, Brianne, I pooped every day. And I'm like, yes. Again, I'm like, my claps and weird wins from clients are like, I'm like, yeah, you did. And you're like, amazing. And I'm like, yes, okay. But a lot of it is because like over time that buildup has happened. It's like creating bigger and bigger space. So we clean it out and then your system can just move better. And then again, normalizing pooping and farting has also been a really big goal for me because it's something everybody really does. And it's not talked about. And I make jokes. I really think comedy is the way of life and how you kind of move these things. There's so many puns with what I do. I take them all. So like, I just how it goes.
I love it. That's awesome.
Yeah, totally. It's just funny when you even said about farting, because it's like I know I never did that. Like, there was no, and like I don't know about Bev, but like when I was younger, I remember our grandmother always used to say, oh no, we don't do that. That's not polite, or whatever. So I never did that. Just,
I just told no.
Yeah. And I actually was at my friend's house and we were talking about this the other night. And she goes, I remember the first time I was so embarrassed to fart. Like I was laughing and I farted. Yeah. And I was like, I was mortified. And my friend was like, Shelly, it's normal. It's okay. I literally was mortified. And she was like, it's okay. But yeah, like, it's just funny how when you grow up, or however you said earlier, was like what you're used to, right? And not doing those things and normalizing farting and pooping. And I'm to the point where I'm like over it now. I'm just sort of like, we all poop. Like, talk about it time. So. You're
like, I'd rather feel better. I don't care anymore.
The pressure you feel when you hold in a fart is not okay. I always just like, for some people, I'm like, you're actually your homework. You need to start farting around your partner. I'm like, what? And I'm like, yes, you are holding your gas, which is like making you so bloated. And I was like, that's actually causing your heart. I was like, you need to go home and have this conversation with your partner. And you need to be like, I need to start farting in front of you. And the more you talk about it, I also find it makes it not such a big like event, we'll call it.
Yeah.
Literally, because then over time it'll be less smelly because you're actually letting it go, and it'll just move through, and it'll just be a poof, a silent. It won't be like loud because again, when you are having to adjust your body or you get like a loud sound and stuff, that usually means you're not actually like relaxing enough to let it kind of go. You're still kind of hanging on to it because you're slightly nervous. So the more you actually do it, it's just like retraining your system. Now, like you can just like let it go and no one even knows there's no sound.
Just
I call it, that's how you know like you're around like good friends and family and like have a relationship, because you can just boom.
Well, I'm going to say this, and Bev knows this, seriously, like my husband was always like, he always farted, always.
But I find men just do that. Like I find they're better at that.
Yeah, they are. But he was known as the gas man, the fart man. Like he always was known that. But the last couple years, he has not. And I'm going to have a talk with him about that, because I'll be like,
like something switched. What happened? Here we go.
Yeah, that's why I'm like, I think I
what are you holding?
know what happened. I actually do know what happened. So I'm going to have that conversation with him about it. But it was just odd and weird to me now. Like obviously back then when we were, not talking about it, like it just felt like taboo, right?
Yeah.
And now it's just like, like everybody poops and everybody like you have to.
Well, and there's just so much. Like I remember Brianne telling me that, your guts is like the brain of your entire body.
Mm-hmm.
It needs attention. It should be talked about. I mean, there's just so much that I feel like society for so long has created a problem, and we just need to start to change that problem and just have more conversations. I look at it even like with mental illness, PTSD, like all those things way back. Nobody talked about it. Don't express emotion, hold everything in. Like I feel like for so long we've been always taught to just suppress, hold, don't express. And that just causes so many issues on our whole entire system. And so it's just breaking that barrier and just moving forward and starting to make some changes. And this is also why I love talking about it with my clients, or, wanting to have Brianne on our podcast, because it's just such an amazing thing. And I think we need to start having more of those conversations, and it's just normal. And there's so much you can learn about yourself and what is going on inside your body. And I think it's important, to know that. Just, the more education, I think the better equipped we are, with tools. So.
For sure. Yeah.
Ditto.
Feeling good.
Yeah.
Feeling good. Yeah.
Yeah, exactly.
And I even just think about I just think in my mind, just the removing of toxins that can build up, how much is in our food of like all this disgusting stuff as well, that just like that elimination as well. So just keeping things really healthy and not building that up as well is, I don't know, pretty important.
Yes.
Is there anything else? Is there anything else you'd like to add that we haven't talked about today?
I feel like a big conversation I get asked about a lot is parasites.
Yes.
Okay.
Yeah.
So I will just like highlight a little bit. Just obviously,
please.
Yes.
When it comes to cleanses, I get asked between a bunch of different stuff.
Yeah.
My big thing is some of the stuff is very like wellness trendy, and I feel like you can get locked into some of like when you're kind of scrolling and it kind of like wait, this could be something that I should try, or this would benefit my health. And some of those things are super beneficial. That's how I kind of also got to know my own health. But with anything, I always just tell clients, I'm really here to support you. I just want you to be well educated in what you're doing. So I always say, do your research. So making sure it's coming from a reputable brand, person, or practitioner. It's not something that's coming from an influencer, because a lot of people get paid to promote some of that stuff. So I always just like highlight that. And then I always say you have to make sure your gut, before you start to do anything, if you have a bunch of buildup in your system, you could do a cleanse, but you're not going to feel really good. You could probably actually do more harm, because when you do some sort of type of cleanse, for the most part, you're purging your system. But if your system is not in a space to be purged, that is where some issues can come. So I always say, go see a colon hydrotherapist, making sure your system's nice and clean before you start to actually do that kind of process. And then parasites. So most people are all, again, I feel like a lot of stuff has just started to recently come into highlight for people and understanding it. When I first started looking into it, like I could even only find like research articles that were like not even 10 years old. So even like with the gastroenterologist kind of academy, I can't remember what the specific articles or the research part of it is, like the technical term. I couldn't find a lot about that. So then I started to go down a literal wormhole, where there is like a parasite kind of organization. There's an international one. It's in the States. And that's where I started to find a lot of good information on. That's where I learned they're everywhere. They're part of their ecosystem. And they're the different kinds. So Western medicine and holistic treat them both very differently, how you test them, how the process of it. So it is just one of those things where don't treat it until you for surely know that you have that kind of infection. Because again, you could just be taking something just to take it to see if it'll work. It's expensive. And some people are like, I did this cleanse and nothing came out. And I'm like, because when you look at parasites, there could be other things going on in your gut. So they live off of candida, which is like yeast, and metals as well. So if those are still prominent in your system, those guys are still thriving.
Oh yeah.
That,
they're not vacating.
We're like, we're going to be okay. So, so if you don't, again, internally clean your system, how I kind of passed my own, I didn't do a cleanse. I really just worked on creating, I kind of like talk about your gut as being your own microbiome aspect, your own little ecosystem. Everyone has it. So if you make that efficient, those parasites will just naturally go on their own because they don't actually have the capacity for it. And that is something very cool that I have been seeing with clients that have been working with me for a while. So they will pass parasites on their own. They'll like send me photos. I'm like, what is that? And I'm like, and then I'm sending back clapping emojis. Congratulations. I was like, give you a star. I was like, congratulations. You passed your parasite. That means we have reached optimal gut health. Yay. Because that really is just saying that your system is like, oh, heck yeah, these can't thrive anymore. If you do have a really beneficial system and it's functional, they will pass on their own. But there obviously are things that you do to create that system.
Yeah.
And parasite cleanses are still beneficial. It's not ditching them at all, but it's really making sure your system is clean. So colonics are definitely needed when you do a type of cleanse, and usually at home enema. Because when you're doing that type of cleanse, you're actually purging your system. So there's die-offs. So that usually causes constipation, and then the toxin release that happens. So another thing that I always make sure with clients is the same thing when they come to me, like, I saw this parasite cleanse, I saw this stuff. Is this a good one? And I'm like, there's so many out there. You have to be the judge of that and do your own research, because a lot of it is like, again, I'm just here to support you. And I don't really recommend things I've never done or tried before. Yeah. So the big things is making sure there's a binder. So the binder, when you kind of are doing a type of parasite cleanse, is really helping draw in those toxins to make sure they don't stay in your system. So common ones are psyllium husk. That's the kind of the best binder I always recommend. I'm like, it's fiber. It's going to feed also your gut bacteria, and also just, it's a natural stool bulker that'll help kind of really clean things out. Another that people do use is bentonite clay as well, and activated charcoal. Those two I personally have never done, but that is a common one some of my clients have done, and they really like it as well. So there's just options out there, but just always do your research.
Yeah.
And then again, clean your gut first. Get that functional.
Prep.
And then I usually just, when they start to pass with me and in our sessions, and then that's when we work at it. Because up until that point, I'm like, they're in there. Are they changing anything about you or what's going on? No. But there's other things kind of going on. For my own journey, I had to clear out all the yeast and the impacted stool. And then my parasites came out like 6 months in my journey. For some, they come out session 1, and that tells me that was the biggest issue and it's gone.
Nice.
For some, they all say like, that's where we have to work on things. So it's very different for people. So it's the same kind of thing. So I usually just say, just don't take things off the internet or like it's off the real. It's just, that's where like my very like I said, like I'm very like yin and yang. The yang part of me is the science, the nursing side of things. The yin is more the holistic. Let's go with more natural, like the water, the flow, the energy, and it is muddy in the two. So I bring both of those. So that's kind of like the only like 2 things I think I would really want to touch on outside of what we kind of all really mentioned. So
yeah,
it's awesome.
that's great. And I guess my next question to that, to add a little bit to the parasites, is like, how do you know if you have them though? Like if they're in your body and you're doing all the things you're doing.
Yeah.
Like what?
How would we?
How would you know?
Would there be any symptoms to indicate that you could possibly have parasites?
Yeah.
Yeah. The thing is, they're kind of like generic symptoms for most, like digestively. So it's kind of one of those things where it's like you can go in with the bloating, the diarrhea, the constipation. The other things I really think are like insomnia. So especially near the full moon, they definitely are a lot more active, and the sugar cravings. They're really intense, especially in the evening. So usually that's like a pretty key indicator that's either for me, you got something like that going on, or it's actually like you got some bacteria overgrowth with yeast.
Okay.
So that's just like symptom management wise. That usually is like the biggest things. Other ones are like abdominal pain, unexplained weight loss, just because they absorb so much nutrients that they literally just like so then you don't absorb them. Muscle aches, fever, chills, really, really tired, skin rashes, like excess gas, like more than what you kind of just really like are used to. Blood or mucus in your stool, that's also a big one as well. And then and also the like rectal itching. So and it's usually at night for the most part.
Interesting.
That's usually when they're active.
Okay.
But those like they're again, it's kind of like that's more like the umbrella of what it'll be, but will they necessarily come out? But that's kind of just the start.
You want them to?
I know. You're actually your farthest part of they live like if it's an intestinal parasite, they hang out the farthest exit. So that's like in your right lower quadrant. It's literally called the region of worms. And then the other ones that are commonly that I see that I get rid of clients are liver flukes, and those hang out in your
Okay.
So those are the common ones that I really see during sessions.
Okay.
So
All right. Awesome. So now that we've covered everything, where can people, like you said earlier, it's on your website. So where can they find you? Where can they get this information? Are you on anything where they can contact you?
Yes. 1 second. Can I just, before my laptop dies, because I'm very glad. Okay. Yes. So I have social media accounts on Facebook. So it's under WellBelly Colonics. And then same thing with Instagram, WellBelly Colonics. And then through there, I have a website that's usually linked. Even if you typed in on Google, it's linked there. And then as well attached to both my Facebook and Instagram accounts.
Awesome.
Website has a lot of information on there. So there's a massive FAQ section regarding colonics and as well as the coffee enemas. And then just in general, contraindications, kind of who applies for that kind of aspect. and then booking kind of information. And then there's my online booking site as well.
Perfect.
So you can go, I think they're all linked in there. So
Amazing.
Awesome. I will definitely have all of your information in the show notes. So if anybody does want to get hold of Brianne or ask her any questions or just take a look at her website, it will totally be in the show notes, and you can ask her things that maybe we
All
didn't
the
discuss
things.
on here.
Yeah, absolutely.
there's no weird questions. I always say, I'm like, there's like nothing off topic. I was like,
Well, I mean, it's poop.
yeah,
Yeah.
there's,
true.
there's really nothing else.
No.
Yeah.
And I have to say that, you know, Brianne does have that beautiful bedside manner. You know, like she really makes you feel so comfortable, and she just takes care of you, and she chats with you just as if I would feel like as if I were at the hospital. Like you would just be there, and it would be like so lovely to have you there, just feeling like supported. And you definitely do that in your sessions as well. And so you have that gift for sure. So I just hope everyone that's listening that maybe is a little intrigued, it's like just meet her, just go see her. She'll make you feel so comfortable.
Yeah, definitely.
Yeah.
I usually have my music playing on the background. So
That's
usually
right.
people thought like they feel like they're at a festival sometimes. It's like perfect.
Yeah.
That's like we're just jamming.
Yeah,
It's true.
exactly.
It's true. Brianne does love music, and so do I too. So she'll be like, "What do you want to listen to today?" Like, whatever, doesn't matter. Like, and there's certain ones we love listening to. So yeah, it's awesome.
Yes.
Amazing.
So, yeah.
Yeah, so thank you so much for joining us today and all of our listeners. And thank you, Brianne, for being our special guest today. And we so appreciate you and everything that you're doing. And we look forward to seeing you soon.
Yeah.
Thank you so much for having me. This was my first podcast, so
Oh my gosh.
I'm excited.
Oh,
I will say I feel very left out that I don't have headphones.
oh.
You guys both came on, and I was like, I missed the memo.
Oh no, it's okay. It's just what we do. So we can connect to our mics. That's all.
Yeah, it's all good.
I was like, is this something that I just like had no idea?
No, you didn't. There was no memo on it. You didn't miss. Yeah, you're good.
I just love you guys. You guys look cute. You both look
Oh,
cute.
thanks.
Thank you.
Love it. Oh my
We
gosh.
definitely
Awesome.
appreciate you coming on, Brianne. We love
Yeah.
you. We just love what you do and your work.
Absolutely.
So we really wanted
Yes.
to we really wanted you to be on here a long time ago.
Yes,
but
we
just
did.
not had a chance. But
Yes.
but we're so grateful that you are able to right now, and maybe this was the right time for people to listen. So
That's right.
right,
Awesome.
timing is
Absolutely.
everything. So yeah,
Thank
so
you
we
again for
appreciate
having me. And we winged it, and it was lovely.
It was perfect. It's amazing. Well, thank you to all of our listeners for tuning in today. We are definitely all sending you love, light, and gratitude wherever this may find you today. So take care, everybody. Until next time.
Bye.
Bye.
Bye.